substantiate this discussion and take it from here. And I'd also like to welcome Masraf and Priya, iProbono teammate. And thank you, Jonizi, for joining us. And as far as I'm communicated about, Bidan will be joining us, and Anurag Subedi, who is outside Kathmandu on a trip, is trying to join us, so we might have them as well. And I welcome you in this stressful time, discussing very important topic, and I hope we'll have a fruitful discussion and we'll set foundation to something really important in relation to mental health policy in Nepal. So welcome everyone, and thank you so much.
Thank you so much, Barun sir. Before I move forward, I'd like to apologize beforehand because my internet connection is really not stable today as well. So apart from some technical glitches, I'd like to start with a brief introduction on what we are going to do today. So first we have some introductions and welcome remarks, and after that we'd like to discuss on the issue itself. That would be the aspects of mental health, the legal and policy vacuum on the issue, and how this gap aggravates the situation. That presentation would be given to us by Dr. Sagun Ballabpan. And after that, if the participants have any kind of questions or any kind of information they want to seek from the expert, they can do so. The presentation will go roughly from around 20 minutes or few more. And after that, we'd move forward to our provincer's presentation. He will be discussing on the strategies and action plans to develop litigation and other interventions on right to public health. So he would also speak for around 20 minutes, and then after the discussions, we'll close the session. So that's what we are planning for today. And before we move on to the discussion from Dr. Sagun Ballabpan, I'd like to welcome Mariam to say a few words.
Hi everybody, it's wonderful to see you all, and I don't want to say too much and take up too much of your time, but first just want to give a big thank you to Dr. Pant for joining us. This is, I think, a really great opportunity for us to find out more about what's happening in the mental health sphere in Nepal. I know pretty much everybody here, and Dr. Pant, we've been having these fellows meetings online over the past few months during the lockdown. So I'm just really pleased to see everybody here and that they can share in some of your expertise as well. And just for context, I'm iProbono South Asia Regional Director. Apologies to everyone who's heard my introduction about 99 times. I'm also a lawyer. I'm based in the UK, usually based in Delhi, during lockdown based in the UK. And my specialization is immigration law and also women's rights. And of course, mental health falls into that in various different ways. And I know that two members of our India team have also joined, and we're working on mental health issues in relation to the kind of support that lawyers might need when they're working on sensitive cases, for example, on child sexual abuse issues, but also the kind of support that they might need, for example, during lockdown or when there's a particularly difficult case that they're working on. So I think there's so many different areas that this topic sort of reflects on. And I know that in Nepal, it's very specific because of the legislation that's being worked on. And finally, just wanted to thank everybody. I'm not going to name you by name because that would take a long time, but just thanks to everyone for putting this together. And really good work on this from the side of the fellows. As you've seen, the papers that you've been working on are now being published one after the other. And I'm really pleased to see that a lot of the work that you've all been doing in Nepal is now being disseminated, not just at a regional level, but at an international level. And I know Meenakshi can verify this, that we've actually been, receiving requests for the information from Nepal from partners all over the world. So that's really, really exciting. So thanks all. Looking forward to this session.
Thank you, Mariam. Now, without further ado, I think we should move on to the issue itself. Dr. Pant, over to you.
Thank you, Vandanaji. I'd just like to share a few slides, if that's okay with the team.
Yes, please.
Sure. Respected chairperson and Varun and Praveen. I've known them for quite some time now, and Vandana ji and all of you. It's great to be here talking with you all today. When Praveen asked me to make this presentation or talk, I mean, he talked about this a few months, maybe a month back, but then there was all this delay, after which 3-4 days back, he asked me to make some talk about the topic that we're going to discuss today. So, I've been so busy over the last few days, and just coming up with this was something that was very anxious for me, because I'm a clinical person, not a legal person. So meeting with legal experts from Nepal and abroad just gives me a sense of anxiety. But then I think you'd bear that with me for the time that I'll make this presentation. I just decided to build up this presentation from where I left in the Prime Minister's office maybe a month back. So the Prime Minister of the country, Mr. KP Oli, was quite interested in mental health situation due to the COVID epidemic in Nepal. So a few of the experts from the country were invited to the Prime Minister's office, and luckily I was one of them. So even luckily, I was the one who got an opportunity to present in front of the Prime Minister. And then I was talking about the mental health gap in Nepal, how the situation is, what can be done, what is being done, and all of that. So I think some part of the presentation resonates to what we want to discuss today. Of course, not being a legal person, there might be some legal gaps that I would leave Probin to fill in a little later when he presents. But I will try my best to give you all some overview of what has been happening in Nepal, what is the situation like, and all these things related to mental health. So just to begin with, as again, I work in Institute of Medicine, Tribhuvan University. This is one of the biggest hospitals in the country, and not just a hospital, it is a deemed university where we are kind of involved in training mental health professionals. We're also involved in training undergraduate and graduate students across various disciplines in medicine, and most of my work is based on teaching and training and policy reforms and all these kinds of things. So let's start with mental health situation in Nepal. The good thing about last 2 years is now we have official data on what is the mental health situation in Nepal. And I'm also lucky to be a part of this big study that happened over the last 3 years. This was the National Mental Health Survey. The first was the pilot survey, and the results were published in 2018. With that, we estimated that the prevalence of any form of mental disorders among adults was around 13.2%. Depression was again a very common psychiatric problem, with prevalence being 3.4%. And what was more worrisome was we caught hold of a lot of suicidality, which was around 10.9% among adults and 8.7% among children. So the pilot study, which was based on a very small sample size, was, uh, let's say, extended towards the whole country. And we did a huge study involving all the 7 provinces and about 15,000 sample size, 9,000 plus adults, 5,000 plus adolescents, 13 to 17 years. And now we have a national figure of mental health problems. We have the burden of mental health problems and a representative data. So with this, I can say that the prevalence of any form of mental disorders in our country is 10%. So if you look that into context, this is a huge public health problem, right? Depression is around 2.9%. Alcohol can never be separated from mental health. It is an integral component of mental health problems, and comorbidity so was 4.2%. And what was again worrisome was suicidality, which was around 7.2% among the population. So should we worry about this, right? Leave aside everything else, talk about suicide, because it is the one definite killer, or the reason by which people with mental health end up dying. One is overdose due to drug addiction and intoxication, and the other is suicide. And suicide, I think, is a major public health problem. Everybody, everywhere in the world is concerned about the rising number of suicide. There's 40 suicides per second across the world, and it's a big public health problem. And we got a similar figure in Nepal, like suicidality was around 7.2%. Um, Currently, at this point of time, we estimate that around 6.5% of the Nepali population have suicidal thoughts, okay? And the lifetime attempt of suicide attempt was around 1.1%. So, I mean, these are not simple numbers. They have a huge policy and implications that has to be addressed with all that we need to do in the future. So, but I showed you the picture, but in reality, there is a huge treatment gap. So and there is an estimation that around 90% of people with mental disorders or psychosocial disability, they are they don't get proper treatment, right? Or they don't get treatment of any forms. So there are many reasons for that. We are low in resources. We have less manpower. If you talk about the number of psychiatrists for the country, I think we are somewhere around 200 for the population of the country. And this number has doubled over the last 2 or 3 years. So it was pretty grim before that. And in government setting, for this huge government organogram, I don't think a lot of you will believe, but there are just 9 full-time psychiatrists in the government organograms, right? So that is that is the situation of the manpower. There are very less clinical psychologists in the country, around less than 40. A lot of psychologists now, but not with a good clinical base, and a mushrooming number of psychosocial counselors, which are 6 months and 3 months training based counseling, which is not supervised, not monitored. So we actually cannot rely on them for considering them a quality mental health providers. But of course, in setting like ours, anything that's there is good enough, right? And there is very big problem of stigma and discrimination. If I were to do a survey, most of you would still think that mental illness, if I ask you to close your eyes and think about someone who's mentally ill, most of you would think about a person who is not bathed for months, with tattered clothes, walking in the street, self-muttering, and then shouting and crying. But that is not the real picture, right? These are the minorities of the big mental health problems. But of course, a lot of us still think that mental illness are just restricted to these people who are discarded in the society, and it's a very big discrimination and shame to be someone with mental illness in our country. And not to mention, there is a lack of intersectoral, interministerial collaboration. So everyone is doing their part, but then coming together has been a problem that we've faced for a long time now. So what has been done? So in 2053, around 1996, we had a national mental health policy. It was quite a milestone, but then over 20 years since we had the national mental health policy, in terms of the implementation, there has been a lot of question marks over various factors, right? It had ambitious goals, the goals to assure that there is access of mental health services at the grassroots level. There were goals of improving mental health manpower and infrastructure, which was somewhat addressed. And there was a goal of protecting human rights of people with mental illness. A Mental Health Treatment and Protection Act was drafted, but it was never ratified by the parliament, never went forward. It is again dusted somewhere in the cabin of some ministry, we don't know. And then they talked about, protecting rights of people, which has not happened over a long time. A lot of movements have been happening right now. But I think all this was taken into consideration when we revised the National Mental Health Policy in 2007-3, which is around 2017 AD. And now it has been a long here and there movement of the document. It got a lot of momentum when Gagan Thapa was the Right Honorable Minister of Ministry of Health, but after that it has again not got so much interest and attention. And now in 2077 we have the Rashtriya Manasik Swasthya Rananiti and Yojana. So there are plans of action plan, and which is again going through a lot of process trying to reach the ministerial table, and we hope something will happen. I'm just highlighting on these parts because in terms of the need of the society, in terms of care, protection, treatment, support, mass education, a lot of awareness. We have enough in the papers, at least some of it in the paper. But the problem is it is not taken as a major public health agenda. But things are changing somewhat. We first sensed the change when there was a 2015 earthquake. A lot of the ministers maybe suffered from anxiety because of the shaking Singha Darbar and all these old buildings that ministers stay in. So they kind of showed some interest in the mental health. Then, over the last 2 years, we finally have a dedicated table in the Ministry of Health, which is dedicated to mental health. There's a mental health unit under the non-communicable disease unit. So, I mean, there has been some progress. So if you talk about the proposed National Mental Health Policy of 2073, it has 5 domains of work. Just to translate it to Mariam and maybe to
Thank you. That would be really helpful. I can just about read the text, but I don't understand it.
That's why I'll just make an easy translation for you. So the first point is we want to make mental health accessible to the ground root level, and which also includes psychosocial support. So the policy envisions accessibility of basic mental health services in the grassroots level, which was never there. The second policy envisions adequate manpower and human resource development. So we're talking about developing more psychiatrists, more psychologists, more occupational health workers, maybe more mental health, social workers and kind of stuff. The third policy envisions that there is a lot of stigma related to mental health and discrimination associated with it. So how to protect their human rights? So how to, get hold of that and do something about the stigma and discrimination. So the third policy works on reducing stigma and discrimination. The fourth policy is working towards ensuring essential human rights with people with psychiatric illness and mental illness and psychosocial disability. And the last policy is more towards research and evidence generation, and so bringing on more evidence in a clinical basis, or maybe like we are discussing right now from a policy basis, from a legal basis. And that is what the mental health policy is aiming for. In paper, it's quite ambitious, and now they have a plan of action to ensure that this is going to happen. But it is always about the ownership taken by the government, and we're always skeptical about that. So what kind of supports that we have had from the government is that government, at least has now, started taking some ownership and has involved people and relevant stakeholders in their cluster meetings. Right now, there is some interministerial collaboration. The Ministry of Home Affairs, which primarily takes care after people in rehabilitation centers and drug addiction programs, is making some liaison with Ministry of Health. And then there's also a big chunk of collaboration that has to be done with Ministry of Women, Children and Senior Citizens. The biggest development has been in the field of non-governmental organizations. They're doing excellent work in terms of community mental health programs, research, advocacy, awareness, and these are the things that are going on in a use basis. But these are again NGO-based programs, so the reach is limited to the area they work on. And now we also working towards an intervention targeting suicide prevention, and the mental health action plan has somewhat tried to address that, and looking forward to find some solutions for it. When I made this presentation to the Prime Minister, we also talked about there is a need for increased manpower in government organogram. In Nepal, any progressive action needs a direct supervision or willpower of the people in the government. So if there's someone in the government who is taking responsibility, then the voice is heard by the Ministry of Health. But then, because we have so few mental health professionals in the government organogram, I think that is one reason that mental health has not been has not received so much attention. And then we also need to liaison with other promotive health services. The community mental health services should expand. There should be a lot of research, and we are also envisioning training and deprofessionalization of mental health services. So last 5 years, we've come a long way. We had a dead policy, which is being revitalized, not yet approved and endorsed by the government, but we're working on it. And now we have a action plan, which I think will be achieving it would be a milestone in the mental health in Nepal. But what we lack altogether is the community movement, right? A few organizations, like there's an organization called Koshish Nepal. Some of them are doing some work in terms of the consumer movement, talking about the rights of people with mental illness and psychosocial disability. They are talking about that Nepal has ratified for UN rights with person with disability, but then a lot of actions have not happened. And this needs to get more attention. And I think this is the point where legal framework has to step in. When I talked about the National Mental Health Treatment and Protection Act, even in 2006, they were promising statements in the doctrine where they talked about guardianship, and then they talked about legal guardian. There were concerns about confidentiality, protection of property, and then all these issues. But that has not been taken very seriously in the government setting. So all in all, I think for last some time we've had some movement in terms of the policy. Things are starting to come up. We academicians, my head of department at my institute takes keen interest in these activities, and there's a lot of intersectoral collaboration going on. There's a lot of intersectoral discussion going on, but I am not sure how much of the legal perspective is being taken into consideration, right? So that has to come in, because after all, safeguarding policies, safeguarding the rights of people are so important. You may have the best policy in papers, but then if there is no mitigating or monitoring mechanism, even in the legal aspect, I think there will be a lot of unexpected outcomes in the future. So I think we have to force and work together for the endorsement of national mental health policy. The suicide is a big problem. I think we need to have a national suicide prevention strategy, and we need to work on and build on to what we have achieved over the last five years or so. So tomorrow, interestingly, is the International Mental Health Day. October 20 is celebrated as International Mental Health Day. So this time in Nepal, we translated the theme as सबैको लागि मानसिक स्वास्थ्य पर्याप्त लगानी व्यापक पहुँच जसलाई पनि जहाँ पनि. So that means mental health needs a lot of investment. Everybody's talking about the importance of mental health, but without money, there's no advocacy. So there needs to be a lot of investment in mental health in terms of all the barriers and all the problems that I talked about right now. There is a WHO quotes that for $1 investment in mental health, there is a $4 return. I don't know how that translates in Nepali, but then investment in mental health has its benefit. And so we're all working on that. And I take pride on distributing suicide helplines every time I present about mental health and issues. So at Teaching Hospital, we have a toll-free number. So that is the number that it's there. And there's another national number, 1166. So please distribute that. And anyone who is suicidal, just they can call us and reach out to us, because we believe public health matters, but even one life matters. So I don't know how much time I took. I end my short presentation here. I'd be happy to have your questions. Thank you very much.
Thank you so much, Dr. Pant, for not only for explaining to us about so many issues, so many aspects within such short time, but also for finishing exactly on time, for exactly finishing our 20 minutes. Thank you so much for that. And if we have any other clarifications, or if we need any other, if we have any questions regarding the issue, we can ask that to Dr. Pant right now. Participants, if you have any questions.
May I ask a question?
Sure, ma'am.
Hi. I was just wondering regarding human resource aspect. As far as I know, because I was quite interested to explore this area, mental health area, and then when inquired about psychiatric as a separate discipline to study in the postgraduate study in the, for example, IOM, uh, the number of students interested to pursue that career is very lacking, and sometimes those seats go vacated, as I get to know. So what are, I think, is it, does this problem stem from a systemic neglect, or let's say the public sector neglect, or are there any other causes why skilled human resources are not being prepared in terms of in terms of strengthening this area? I was quite interested to know about this. Thank you.
Yeah, so thank you for your question. I think times have changed and paradigms have shifted. For I've been working as an assistant professor for last 5 years now, and then none of our seats are empty now, and there is a big waiting list for people to be into psychiatry. The demand has increased, of course. People are liking it. The subject has changed. The time has changed. The understanding has changed, and it's a totally different vibe and atmosphere right now around mental health. But understanding to your question in one aspect would be there's so less vacancy in the government organogram. So right now we have a lot of ample amount of psychiatrists that are graduating. Just to your notice, because I'm also a member of the Psychiatric Association of Nepal, I'm an executive member there. We have around 20 to 25 psychiatrists, new psychiatrists joining the workforce every day, which is like 10 years before you could not have thought about that number. Because 10 years back, we had a total of 32 to 40 psychiatrists in the country, and now we have 25 in a year. So things have improved. Even private medical colleges have started the subject. But what I want to emphasize is psychiatrists are in the topest part of the pyramid. For a public health modality to be successful, you need to have people in the grassroots. So I envision that not just psychiatrists, grassroots social workers, empowering low cadre health workers like health assistants, female community health volunteers, who are much everywhere there in the society every time, have to be empowered about mental health issues. That is why we at our institute not just talk about super specialization, we talk about deprofessionalization. Sometimes we train dhamis and jhakris for ensuring that at least they make right referral of needy psychiatric patients. So as I said, things have changed, and it's a very noticeable change in terms of not just policy reforms, but in terms of the acceptability of psychiatry among students, and also among people. Like my private practice, such people are coming to a psychiatric clinic, which would be unimaginable 5 years back, right? So, we as academics, in this field, believe that we have to be the change that we want to see in the society, and that is something we've been taking upon ourselves. And it's not a grim situation. Maybe it was true 5 years or 6 years back, but now it is not. Thank you.
Thank you, sir. So Barun sir has just texted me saying he also have another question. Barun sir, please.
I actually might be jumping in with this question, but one of the questions I particularly ask you, because you are both academic and you're also working as in your clinical practice. So as a professional working in that particular sector of mental health, what do you think professionals such as lawyers or legal professionals or those working in policy aspect can do as part of their work that would ease your work or help you attain what you're trying to attain? So it's more or less simple. I'm trying to figure out like what are the things that we could help. I saw that there was legal professionals involved in drafting of the act and drafting of the policy. Beside that, do you envision as a professional working in that sector a particular role for lawyers or those in policy making capacity, or those who can influence the process, do particular things? Is there something that you've identified, or is there any such thing?
It's an excellent question. And one part of why I feel I'm successful is that I have Praveen beside me as a friend. So all these questions that come around, and we chat about these things every week, maybe. I have a weird question for him about all these legal procedures. And, being in teaching hospital, you get to see these odd spot cases, the talk of the town kind of cases in mental evaluation and kind of stuff. So it's always a luxury for me to have a friend. But then even from a mental health perspective, I think we need to work more with people from the legal background, because there is a sense of fear that comes around when people talk about the word medical legal. I have I have been fortunate to work with the Medical Legal Society of Nepal, which is called MELSON, and Dr. Ariyar Wasti. I don't know if you all know him. He's been quite active, and he's a bridge between legal kind of world and the mental and the health related ministerial work. So all these stuffs where legal issues and support come along, it is always handy to have someone from the legal background. We can write papers together. How about writing a policy paper on mental health together, right? That can be one. So we can grow together as an academician. We can be referral points, right? We can you can refer people to me. I can refer people to you. Then we can liaison with other disciplines. We can develop. We can write research grants together. We can make projects and policies together. So it would be a very nice amalgam to bring on mental health professionals and legal professionals together. And I sense that is starting to happen now. So there will be a lot of productive outcomes. I may not be able to share all of them, and even more outcome would be expected in the future. But I think we should start collaborating more. Yeah, definitely.
Thank you, sir. Now, if we don't have any other questions, we can move on to our next presentation that would be given to us by Praveen Subedi, sir. Do we have any other questions?
I do. Just supplementing on what Barun just said. Hello, Dr. Saab. This is Anurag. Uh, we've been Namaste. We've been hearing a lot about your work, about yourself, and we're so fortunate to have you here, talking about mental health issue in exactly the time where we need this kind of discussion. So my question is particularly a bit personal, but yeah, just to supplement on what Barun was saying. So I was also wondering this about the legal and mental health related amalgamation. Where do we see the gap? Do you see, as a everyday practitioner in this field, any specific legal and policy challenge? Maybe we can have that in our second presentation. Where is the where's the spot that we would like to hit the nail with? So this comes from we are pretty much unaware about this kind of situation. We've been talking a lot of issues about uh, physical health. If we check our labor law, we have, I don't know, we have like so much of a protection of physical health, physical hazards in the workplace, and a lot of labor related aspects are associated with physical health, but we never talk about mental health. Not even, not even in our office. If we are like, if we really enjoy working in our office, or if there's any sort of a uh, uh, sort of a mental health related issue in the workplace, we never talk about that. And none of our laws, it's good that we're actually thinking about a new policy and a new law on this field. But what I see is we need a lot of uh, co- collaboration, in the sense that these components are reflected in all other laws. It's good to have a single law, but yes, definitely we need to revise all of our laws, particularly on the labor related issues. That's what I wanted uh, to address here. So so practically speaking, I'm sure it's pretty obvious, but my question is, does this kind of disasters and pandemic aggravate this situation of mental health? And how do we keep ourselves sane in this kind of insane situation? So yeah, one or two tips would be very handy, you know.
That's a really good question. We all need that.
Yeah, over to you, Dr. Saab.
I think yeah, some technical issues.
Maybe we can come back to that again uh, at the end of our presentation. I think.
Yeah, we'll keep a note of the question, Anurag. It's really important. Actually, I'm glad Priya is on the call, because Priya, maybe you can just very briefly at the end of the call also mention the support circles in India.
I'll do that, Maria.
Okay, so in the meanwhile, we can move on with Praveen sir's presentation and then get back to the question again. Praveen sir, over to you.
Sure. Thank you, Bandana. And first of all, I'd like to thank the entire iProbono team, and especially Bandana and Barun for having me here, and also for this opportunity as well. So, working in this sector of mental health is has been our priority, mine as well as Barun as well as Sabun. And Dr. Sabun and I, being a childhood friend as well, we have been consistently talking about and trying to work in these issues. Maybe it has been 5-6 years, and now I think it has been the time has come when we can materialize this issue together. And Barun and I, we are also working drafting a mental health policy brief, and it's in the verge of being completed. And we'll soon send it to someone for having it a final touch. And basically what we knew from Dr. Sagun's presentation as well as our literature review is that many work has been done. The work is being done compared to last 10 years ago or 15 years ago. In this 15 years time, many things is being done by I just got message from Dr. Sagun that his internet got disconnected and he'll join in a while.
Do we want to wait? Do you want to wait for him, guys, or do you want to carry on? It's up
No,
to
I
you.
mean, Mariam, thank you for your concern.
Oh,
Okay.
great. Okay, great.
So many works is being done, and but there are so many things that is to be done also. So thank you, Dr. Sagun. I was saying that we have been working and we wanted to work in this issue together, and I think we are getting a good forum or perfect forum for us to materialize the things that we have been discussing since 5-6 years. So although there has been so many works being done and the mental health being prioritized by government as well, but I think that there are some areas where we need to work for specific policy review and also legislative review. Because from my preliminary review of the existing public health related legislation and other legislation, there are certain areas where we can work for policy review and statutory review. So first of all, what I think is that we need to have a very crucial plan, like a plan among ourselves. If we are working in this area, then we need to move forward having a strategic plan. We need to have a multi-sectoral suicide prevention, because we need to focus on suicide prevention and mental health protection plan. That could be a thing that the institution or entity like CSOs that can do apart from government, or being playing a supplementary and complementary role to the work of government. And also working as establishing a center, for example, mental health and policy center or mental health law center or something like that. So that is just my plan or my thought. And in regard to the strategies that we can adopt, listening to Dr. Sagun's presentation and my review as well, there are certain areas where we need to have a judicial intervention. Why we talk about judicial intervention is that we have been advocating, like the psychiatric or psychosocial counselor or the people who are working in this area, they have been advocating since 20 years or 30 years that we need this kind of policy to be adopted by government of Nepal because of so and so health situation and our so and so international obligation that we have and so and so. But if that is not being implemented as a policy, or even if the policy is not being materialized, or even if there are certain kind of per se disparity that is being implemented in existing law, then we can, or we have a guardian of our fundamental right, or guardian of our constitution, that is Supreme Court or any other court, where we can proceed having a strategic approach. Like, for example, first of all, we need to go to government and say, okay, these are the disparity, or these are the things that should be considered for legislative review, and or not even legislative, but there are certain things that is to be reviewed or adopted by government as well. So talking about what are the instances, or what are the places, or where we can work in this mental health illness is, first of all, I'd like to talk about the disparity or inequality that is here in mental health related or health related laws. For example, we do not have health insurance under medical health illness. I mean, there's no mental health illness covered by health insurance plan. So that could be one very important place where we can work. And another issues is we do not have any provision regarding involuntary psychiatric treatment to certain victims of certain crime as well as certain people. Because in some places or in some instances, there might be compulsory or involuntary psychiatric treatment required. For that is required for prevention of multiplicity, or prevention of certain consequences that is like that might occur to that particular patient or entire society as well. So the concept of compulsory or involuntary psychiatric treatment to the victim of certain kind of crime, or certain kind of mental health related people, or mental health prevalent people, should be considered by our law, which is not in which the existing law is very silent. And we do not have consolidated mental health related act, although Dr. Sogan mentioned that in 2006 we had drafted one act. There was a committee formed. The committee drafted a bill, or that was not even a bill because that was not considered in parliament. It was just a draft. And later on, because of so many things that occurred since 2006 to 2020, in this 14 years time, we have been going through so many changes, political, economical, and so changes. So straightforward saying that it didn't come into the priority of government, so it has not been progressed. So we need a consolidated mental health care act. And there are certain situations which we can face, like working in or having interest in this mental health issues, is that the people who we assume, like Dr. Sagun earlier said, that whenever I think about mental health related person, or person who might be mentally ill, I think about the person who is working with torn out clothes, who is like eating anything they find in the road. So even those people are not taken care very nicely, let's say, because those people are being beaten up by police, those people are being beaten up by civilians, they are not treated in dignified manner, nobody cares about them. So such kind of activities done by either by police or even by other civilian or other people should be criminalized, because our law has a very specific provision for protection against indigenous community, protection against such kind of treatment to indigenous communities, such kind of treatment to children. So why not to the person who are like mentally retarded, or they are like mentally ill, let's say, and they cannot speak on their own, because they cannot exercise the remedy, they cannot do whatever they want to do. So in that case, what I'm trying to say is that there must be a criminalization of such kind of activities, such kind of indignified or cruel treatment, or not, if that doesn't suffice the requirement of cruelty, even inhuman or undignified treatment should be criminalized. So that is not provision in our law, although it is like we have laws that prohibits or criminalize caste-based discrimination, gender-based discrimination, so and so, but such kind of treatment, inhuman treatment that is being done to these mental health related people are not being criminalized. So we need to think about those kind of legal reform as well. And one important thing is regarding the reverse burden of proof requirement that is in our law. although our law has provided immunity to completely insane or medically unfit person, but maybe if I have some kind of mental issues, I may not be able to justify, or I may not be able to prove that, or I may not be able to give that burden which is shifted on me. So in that case, there must be some kind of legal or some kind of strategy, or some kind of, I don't know, how we can take this. We might we can discuss about that, but it should not be same. It should not be same level of gravity or same level of requirement of shifting the burden of proof in some kind of criminal offenses to a healthy person and to a person who is like mentally ill or who has some kind of mental health concern. So apart from this, I was also thinking about the issue of drug addiction, which is also a part of mental health. So it is not only the drug addiction, our society, even a lawyer like me, when I think about drug addiction, I think that that is a crime. But apart from crime, that is also a health concern, because drug addiction is not only a crime, it's also a health concern. So we need to have some kind of strategy or policy to address that kind of thing also. These are the things which I believe, or which I think should have the intervention, or there must be legislative review from the side of parliament or government. Apart from that, there are some concern or some steps that government should do in legal reform or prioritizing. For example, although Dr. Sagun said that we are now in the verge of having a government data regarding the mental health situation, but still I am not sure that whether we have a consolidated or central database or not, because in various things or various health related data, we do not have a uniform or consolidated or central database. Because I have been doing research regarding rape or sexual violence cases as well. I'm trying to find out from, since 5 months it has been, I'm working so hard to get a consolidated one door data, or data from one ministry or one place, but I have not been able to get this data. So what I presume is that we do not have the central database, which from where I can, or any researcher or any policy reformer or one who wants to work in this issue can get such data. So we need to have that database as well. And as Dr. Sagan also mentioned that if there is a low-cost intervention that can be done by government, that kind of early low-cost intervention, if that is prioritized by government, then such kind of intervention will lead into protection of personal interests of that particular patient, as well as public interest of entire society. So we need to work together for having advocacy, or for prioritizing the government to work for early as well as low cost intervention that can be done to this kind of patient. And as Dr. Sagan mentioned, that there are only 6 psychiatric doctors for this many population of Nepal, where suicidal cases, it has been like booming day to day because of the every situation of this earthquake or COVID-19 or any other situation of any other social, economical, because there are so many causes behind suicide, and we do not have sufficient resources. And I'm sure that there is some or other kind of disparity in budget resources or budgeting of other physical health and mental health. So in that budget disparity also we can work together. And I'm sure that we do not have 24/7 emergency services to psychiatric patient in all government hospital, because psychiatric illness is also considered as emergency service or emergency illness that is to be provided by government hospitals. But I assume, and I'm quite sure that all hospitals, they do not have 24-hour emergency services to psychiatric patient. So that should also be taken into consideration. And apart from that, I'm now ending my point as well. Apart from that, if we have a special care to women, children, in and other vulnerable group of people of this society, then we need to have a special care, attention, and attitude by all stakeholders, either that be police or criminal justice system or service provider or prison or custody, to have a special care and attention to the people who has some kind of mental health issues. So these are the areas where I personally and I and Sagun have been discussing along with Barun as well. We have been we want to work in this area, and for that, like there are so many areas that needs reform and that needs the voice to be heard. So it's now that we need to prioritize what we can do for short term and what we can do in long term from the time. In this like day before mental health day that we are celebrating tomorrow, it's very nice for us to discuss, come together and discuss about this issue. And once again, I'd like to thank the organizers, Varun, Vandana, and also Mariam for this opportunity. Thank you very much.
Thank you so much, Praveen sir, for giving us the basis from which we can build upon. That was very precise and concrete, and we can obviously discuss more to work on and how we are going to move forward with these issues and these points. Now, before we move on to the questions for Praveen sir, we'd first like Sagun sir to give answers to the question Anurag sir already asked. So, Dr. Pan, to you.
Yeah, I think Praveen has indirectly answered Anuragji's question altogether. So not much to add, but what I think, I'll just give you an example. Like things come up, there was this issue of aiding and abetting suicide that came up. As a psychiatrist, we were seeing patients who were dying by suicide, but we didn't have any idea about how aiding and abetting came into our new laws and how it would have its implication on suicidal cases. So Praveen, I was lucky to have him. I think I am a psychiatrist who saves a lot of money for legal reasons. So I called him and just could find out a lot of information about it, and it helped my cause. So the point I'm trying to make here is we have a lot of identified and unidentified common working space. I think it's time that we should start working on what we have already identified, right? And for all that came into the discussion today. But believe me, once we start to work, we would be surprised to see that there's so much common in our field of work, because we directly relate towards justice, making people happy, making people, giving them quality of life. And psychiatry and even legal sector is all about making people comfortable in their settings and who they are. So I think we should start somewhere. And Praveen rightly pointed out the common work areas could be, we could make submissions or write about the gaps in the policies. I believe that every country should be devised and directed by academic insights and publications. In our case, it is mostly political will. That is why we're misled, right? So I think somewhere the forums like this, we should come up with finding out the existing situation. Like, for example, if I PubMed a paper on existing mental health issues in Nepal, from a legal perspective, I'm not going to get a lot of resources. Luckily, I have Praveen, and then I turn around to him, talk to him. So we should think about coming around with publications in good journals where we can let's say forefrontly at one glance show what we have, what is the existing structure, what are the challenges, what we need to reform, and what will be the implications. A few papers, maybe one or two, just incorporating one from a drug perspective, one from a mental health perspective, would be a game changer, because then these publications will not be ignored by people who would be interested to work in this field. So I believe it should, the policy should be evidence and academia driven. And once we start to do that, it would be a good start, and we would find a lot of collaboration that would extend beyond you and me. Then people would be interested. Now people don't have a connecting point, and that can be one good start. Like I remember I reviewed a few a few papers were probably maybe 2 months back. One was related to mental health policy, one was for addiction. So such kinds of papers should come into PubMed and then Google Scholar or somewhere where people could get to see them, right? And then after that, I believe me, things will start to change. And we saw that in mental health. We had a series of publications that came one after the other, and that is what interests people. That is what will bring on money, and mental health needs money, right? So that's the point I want to make. Thank
you. Thank you, Doctor. So if we have any questions to either of our speakers, this would be the right time, participants.
Yeah, before that, I think Dr. Sagun needs to go to clinic, so maybe we can have question for him and he'll leave. Because I had taken time until 5, so.
I can spare 10 minutes because it's very interesting.
Yeah,
I'll wait for 10 minutes. Yeah, thank you.
Yes, Meenakshi.
Bandana, my question is for Praveen ji though. So if someone has a question for Doctor, then I'll wait. I can wait. Mariam, you go ahead.
Yeah, it's actually just a follow on, Dr. Pant, from what you were just talking about papers. And I think definitely collaborative papers between sectors, which are then shared sort of in different types of publications, etc., are really useful. So actually, I mean, just out of interest, like what do you think an organization like iProbono, working with Lapsoj and people like you, like what sort of issues should we be looking at if we were to consider developing a paper? And I mean, something that is of interest is definitely what you talked about in your session, particularly on suicide and the social stigma in all our societies across South Asia in relation to suicide, but also the fact that suicide has suddenly become a topic of conversation for everybody because of certain high-profile incidents. There have been a series of suicides within the legal profession in India as well. And probably about 20 years ago, this is what happened in the United Kingdom. And that's when they started sort of amending and adapting legislation to cater for these sort of situations. So yeah, so what sort of papers should be generated, what sort of areas should one be looking at as iProbono in collaboration with Lapsoj, and B, just your comments on suicide and thinking about sort of social stigma. Do you have anything to sort of add to what you said?
Thank you. Both diverse and very interesting questions. About the first one, I think because starting some intervention needs to bring things together in one basket. So I think narrative reviews or maybe scientific reviews of any forms, right? Systematic reviews is very difficult because evidence build on to. So narrative reviews, looking into diverse components, at least one focusing on the existing mental health legislature and legal policy challenges and implications, and maybe recommendations, and one focusing on drug policies. We could also work International Drug Policy Consortium and all these partners, by which we can actually firstly bring all the evidence of what we have, then we can identify what we don't have, and then we can make a policy implication saying, okay, these are the reforms that are needed. So like I'll just give you one example. In Nepal, there's been some discussions regarding cannabis legalization. Right? It has just started. Right? If you go by the National Drug Act, which is quite an old act now, it says even consumption of a joint of cannabis is illegal or a criminal act, right? The world has diverted from that. We need to think about things that are based on international practices and then how it holds in different situations. So maybe it would be interesting to start to talk about what is the existing practice here, and then what are the international practices from a regional perspective, like what are the changes that have happened in India, maybe Pakistan and Sri Lanka, which are more close to us, and maybe then from a Western perspective. And in the end, we could actually end up writing recommendations saying, okay, these are the points we need to work on, and then that would give us direction. So something like that. And we can start with one topic or maybe a couple of them, and then see how it goes. For the second question, suicide, as you said, It's quite a broad question, though. Suicide, as you said, is on a hot cake right now. Everybody's talking about it. And to be honest, not many of them have answers for it. It's still being looked into from a mental health perspective. But even being a mental health professional, I think suicide has a lot of complexities, and it's not just related to the mental health perspective. There's a lot of social connections and psychological and all these cultural and religious issues that gets connected with it. So I would say, at least thinking and talking about the existing suicide-related policies, right? So what would be suicide prevention policies or national suicide prevention action plan, right? There are issues on criminality of suicide. A lot of countries are still criminalizing suicide, while some of them are not. And again, these various contradictions of concerns of aiding and abetting suicide, which are always coming and going up there and there. So that can be a scoping point of working. But as you said, you as a legal personnel, maybe me as a psychiatrist, we're all vulnerable to suicide. And we need to work with suicide survivors and suicide attempt survivors, right? So integrating these key players in a policy perspective, both from a legal and a clinical perspective, would actually have an answer. Because these are the people that have actually been pinched. They know the pain and they know what it takes like being in the society with the stigma of being a suicide attempter or being a son of a suicide attempter. So it could be quite interesting to see from their perspective what kind of legal safeguarding they would want, what kind of clinical support or psychological support they would want. And these would be the things that I would like to see.
Thank you.
Yeah, thank you. I'm not sure if I answered the second one because it was a broad question. Yeah.
It was a very broad question and you did. So thank you very much.
Thank you, Doctor. If we don't have any other questions for him, do we have any other questions?
Yeah, Dr. Saab, you didn't answer my second question. Any
Sorry, I didn't hear your second question because of the internet, maybe. So what was it? Can you repeat it for me?
That's it's a common but yet personal question. How do we, any pro tip on how do we keep ourselves sane during this insane situation and in this unprecedented time? Any pro tips that would come handy to all of us?
Yeah.
Not legal or not. That should not be legal.
So even from a legal perspective and from a clinical perspective, we should not use the word sanity because it's a very difficult thing to justify who is sane and who is not. So I would say the basics. I've been doing series of webinars on this for people all across Nepal, and this is an unprecedented time. Initially, I used to say this is a normal reaction to an abnormal situation, but then it prolongs and prolongs, and we actually don't know when the COVID mess is going to end. So I would say the keys to keep you happy and engaged would be make a routine, stick to your routine. So even when you don't have work, don't sleep all through your day, right? The second would be do your regular exercise. You know, you can do some breathing exercise. If you're tired, sometimes take a few long deep breaths, and it's very relaxing. Try to do that. Stay away from information overload. A lot of us are just reading about stuffs that are totally irrelevant to us. So there was a patient of mine who gets up and reads and counts world meter of how many corona cases in a day and ends his day reading that. So stop doing that, right? The cases are going to increase, and there is no point seeing into that. Avoid unnecessary and unreliable sources of reading. Let that be your academia or maybe unrelated stuffs or political news. Stick to reliable sources. Don't follow propagandas. These are always mentally draining. Don't read about cults for now. If you are a religious person, follow your religious practices. If you're not, believe in something that you do, and use this time to develop a new hobby, because one day corona is going to go, but then the time is not going to come back. So if you are a painter, start doing some. If you like to compose music and write poems, this is the time you should start doing, and just find a place to do something. And in the end, don't maladaptive, don't cope in a maladaptive way. I mean, a lot of guys are smoking and drinking and doing pots to, throw away their anxiety. It's difficult for everyone. It's more difficult for you and me. We keep complaining all the time, but I've stopped complaining. I usually don't complain except with my friend circle, which is about venting. But overall, I've stopped complaining because it's worse down there, and we are the fortunate ones who are in the screen talking in this international consortium, maybe. So find something positive to cling on to anytime you have a negative thought. And believe me, this will go. It's a matter of months, maybe years, or maybe even more or even less, but then this will go. But the mindset is something that you should have from right now. Have a positive mindset, stay protected, follow the rules, wash your hands, follow your respiratory hygiene. It'll be all right, right? And just from a personal experience, I've been working in a hospital, which is a COVID hospital, last 2 weeks back. I was doing this psych evaluation and marital counseling for a couple. 4 days later, I got a call from him saying that he was COVID positive. 3 days later, his wife and his daughter was also positive. So maybe I was trapped in the room with 3 COVID people, but because I had my face shield and my mask and I washed my hands, nothing happened. So if you stick to the basics, stay positive, stay engaged, and think in the long run, it will be absolutely all right. In a few years' time, we will think about this time and judge this maybe as the best time of our life or the worst time of our life. That will depend on you. Yeah, in a short, that's all what I would like to say. Thank you.
Thank you. Thank you so much, Doctor. Those were very helpful. And before you go, I'd like to invite Priya to give certain introductions to our work here. Priya?
Hello. Hi, everybody. I'm Priya Vatwani. I'm a program analyst working in iProbono, India at the Delhi office. Right now, of course, we're working remotely, so I've been at home since March. And just like to add to what Doctor was saying on how we can cope, and something that we've been doing with our lawyers in our panel in Delhi is that and of course our partner organizations, is that to develop a sort of a circle for lawyers right now specifically who are dealing with vulnerable children or witnesses or deal with any other matter which can be traumatizing, indirectly or directly. And of course the social workers who day in and day out counsel these children and have developed an experience within themselves to just figure out ways to cope and figure out ways to not let it get to you, so that we can be at our best and serve our clients properly. So for that, we are developing something called support circles. This is going to be a close circle for about 7 to 8 participants, where a social worker and a person who is a mental health professional will talk to people and not just deal with the typical mental health scenarios, but it will be like an open session where people can discuss anything they want. And the experiences they've had while dealing with these children or witnesses or working on these cases, or sometimes it's the work environment which is stressful, the timings which are stressful being in this profession, and the stress that comes with it, and being burned out, having vicarious trauma, all these kind of issues that lawyers or any other professional don't really recognize, and how to recognize them, how to give each other suggestions on self-care, on mental well-being, like Doctor mentioned, breathing exercises or journaling, or sometimes just talking to people who are going through the same experience. It actually really helps. So any sort of a circle that you can form, or in a group of people who are working in the same profession or dealing with the same kind of similar things, can be very, very helpful in the long term. And that's what we're trying to develop back in Delhi. And that's something I think all jurisdictions can use and develop in their own sector. So that's all I had to say. Thanks.
Thanks, Priya.
Thank you, Priya. Now I believe we need to let go of our doctor. So thank you so much for giving 15 minutes extra of your time, Dr. Sagun Pant. We're really excited to have you here, and thank you so much for enlightening us regarding the issue.
Yeah, thank you, everyone. I totally enjoyed. I'm so fresh listening to all of you. Exciting prospects. Just count on me. I've always believed in collaboration because, in a famous conference, I got a fellowship. I got to meet a very famous professor. He's considered the greatest psychiatrist in the 21st century. He's called Norman Sartorius. And I'm always reminded about one quote he said. It is not about what you know, it is about who you know. And now that I got to know all of you, prospects will happen. Thank you. I enjoyed. Have a great time, everyone. Thank you
Thank
very
you
much
so
for
much.
having me. Thank you, Praveen. Thank you, Borun. And if I miss anyone, thank you, everyone. Mariam, thank you for your questions. And thank you, everyone.
Have a nice evening.
Thank you, sir. Now, going back to Praveen sir and his presentation, Meenakshi, you wanted to add something.
Thanks, Vandana. Ravinji, it's something that you said, I'm not quite sure if I understood it correctly. It's more of a clarification. You had mentioned about having legal exceptions in cases of crimes for those who have some sort of mental illness. I just want to understand if in the criminal law in Nepal does not recognize it as a exception in cases of crime, because in India, for instance, there is a general exception that says that if you are of unsound mind, then you're considered as someone who's incapable of understanding that it was illegal or a wrongful act. So I was just wondering if you were talking about your criminal code, which does not recognize mental illnesses or someone being of unsound mind, or you were talking about having a special legislation in that regard.
Thank you, Meenakshi. I think I got everybody confused, or I'm not sure. I was not talking about the immunity or general immunity in case of crime, but I was talking about the burden of proof. For example, in some cases like narcotics or human trafficking, we have the provision of reverse burden of proof. And if it is completely insane, if the perpetrator or alleged person is completely insane, or Dr. Sagan said that not to use the word insane, but still, like our law itself says insane. So if he or she is completely insane, then he or she will have complete immunity. That's what we also have in provision. And I'm not talking about the liability or criminal liability, but I was talking about the burden of proof requirement. So if I'm mentally not sound, if my mental health is not good as of healthy person, then I will not be able to give the proof that I'm innocent. That's what I was talking. Because there should be a level of, the gravity of the burden should be lenient, or there should be some kind of legal issues. There should be some kind of address to be done if that person is not mentally healthy. And a person who is not mentally healthy cannot give the proof of being innocent. That's what I was trying to say.
Thank you, Varunji. Now I understood that clearly. Just wanted to clarify. Thanks, Vandana.
Thank you, Praveen sir and Meenakshi. If anyone else has any more question to Praveen sir.
Yeah, maybe just a really quick question, Pravinji, just in terms of your experience in your legal professional life, how have you dealt with cases where you've had a client maybe with mental health problems, or you've seen and there isn't the sort of legislation to support you on these things? Like, what have you done in those cases?
Yeah, in some cases, like in which the person whom I represent, they claim themselves as having some kind of mental health issues, but it is very difficult to justify, or the court, like, they are not so positive regarding the health or mental health concern. But that was like 2 months back. There was a case decided by Supreme Court regarding the bail hearing. In that case, the court, in a very unusual case, like in those similar kind of those cases, in similar kind of that kind of cases, there was no bail given to such kind of wrongdoer. But in that cases, on the ground that he was a chronic depressed patient, the bail was granted by Supreme Court. So maybe the positive attitude is being developed by court, that I do not know. But as per my experience, if we claim, or if we used to claim in other cases before that, the court was not so positive regarding the mental illness that should be considered while giving bail or while giving the decision. The court was only considered if he or she is completely insane or not. So mental health was not being considered. But recently, the one case that has been decided by Supreme Court, which is though disputed because of a very new trend that has been set forth by Supreme Court, but still there are some cases in which court is considering it.
Thanks, that's really interesting. Thank you.
Thank you so much, Praveen sir, for your presentation and also for your time. Now, I think we need to close the session. It's already been 20 minutes more. And for that, I'd request Barun sir to please close the session. Thank you.
Apologies, can I just be rude and interrupt for a sec? Just a thought from what Priya was saying. So I really hope that, our fellows meets are good opportunities for us all to meet up and discuss and chat. And I know for all of us, it's been such a long time now that we've all been sitting at home, and I'm not sure exactly what the situation is in Kathmandu, but I know that it's tough, and I know that it's tough in Delhi. So any way that we can support, I think these meetings are a really good opportunity for everyone to get together, and we don't have to discuss obviously mental health issues. We're discussing our work, but I think that's also helpful. And I think that, having regular meetings. So A, thank you all for continuing to join us all regularly, and B, just keep us posted if there's anything you want us to set up, any conversations, any people you want us to invite. This was so wonderful to hear Prabinji and Dr. Pant's work. So if there's anything else you want us to do to support in any way, shape or form with research, work, etc., just let us know.
Sure, thanks, Miriam. Now I'd like to invite Barun sir.
Thank you, Vandanaji. So far, it has been quite interesting session. It's been in plan forever. We wanted to do something on mental health issue. We actually even did review of drug policy, which is currently in review phase. And as Praveen mentioned, we started with the review of mental health from right to health perspective, where does it lie? And we're also trying to see and critique the draft act. And interestingly, Sapna Pradhan Malla was one of the committee member while drafting it. But it's a long haul. It's a very interesting discussion, particularly some of the issues raised by Praveen. They're regarding consideration of mental health as emergency illness, prospect of mental health insurance, and involuntary psychiatric support. There was another issue we were discussing this afternoon about the consent of providing medical support to those deemed in need of mental health support is not addressed by law, particularly in order there's consent of guardian is required, but in case of mental health, it's not there. And even prospect of a specific act, which was deemed it's been more than 14 years back, we had a draft and then we lost the piece. Issue of reverse burden of proof, where taking a claim that you're not mentally healthy is not sufficient. You have to establish it on your own beyond reasonable doubt that you actually have the issue is there. And there's a question of dignified treatment. And we also have a very this experience regarding mental health. One of the Supreme Court judges from Nepal, who was considered the brightest mind in corporate law, committed suicide because of mental health issues. We do not talk much about it, and particularly in legal profession, because lawyers are considered as tough, and those who help others, we barely talk about it in our community as well. And there's prospect of reform in terms of policy framework as well. So I think we have had a very fruitful discussion, and everyone participated in it and have shown genuine interest in the topic. So I think this is a good start to something that we can follow up and from our side contribute to in legislative and policy area. And we're also strategizing how we can work together with Dr. Sagun, and we also have 2 other public health experts who are working with us in drug policy reform. They're already engaged in the review process. So far, Been a very fruitful discussion, and I think it is, it's also very practical, and with some of the tips, I think it was worth everyone's time. So
Yes,
thank you
definitely.
everyone from my side as well as from the iProbono team, and I'd also like to thank Priya for sharing her work and how we can possibly replicate in Nepal. We can also discuss that. Maybe it's something like we need to help uh, ourselves before we can help others. It's the key aspect. And also for Oli for being through the program, and Koraki, thank you so much for all is good at your end. Thank you everyone, and try to consolidate what we've discussed today with Bandana and see where we can take this work on specific notes. And I'll share the review paper once we get it done for your reference and for your input. Thank you everyone for your time, and look forward to meeting you on our next fellows meet, which will be like equally interesting on issue of children. Until then, thank you so much. It was really nice seeing you all virtually and being part of the session. Thank you so much.
So good to see
Thank you,
everyone.
everyone.
Thank you.